officially call the meeting to order at 7:07 PM in the Town Hall, 48 Gardner Road. This is the Board of Health, and just remember that we are being videotaped. Okay. So there are no, look through this, there are no paper copies of the previous minutes from December 9th printed. So I would suggest that we table the minutes till the next meeting for approval. Okay. The third item is COVID-19 flu/Maven update. Judy?
Yeah, I went into that this afternoon, and I even went back 2 months to see what our influenza rate was. We had 2 cases. That's it. That's all that's been listed on Maven of influenza.
Okay.
So, and COVID is way down as well. So, we're mostly still seeing some leftover tick-borne illnesses. So.
Okay.
And even that's scattered, so it's almost zero at this point.
I don't know that it's happening here, but last Friday they were talking how the Medford schools closed due to an outbreak of norovirus in that school.
Yeah.
So I don't know if that's reached Hubbardston or anything like that. I haven't heard. You have
Yeah, we have
nothing
to-
from the schools?
Nothing from the schools.
Okay, so
We
that's
have
good.
to see that. Yeah, they've been doing some webinars. The epidemiology department is doing some webinars on norovirus. It rolls around every year. but
Correct.
We should probably check with the school nurse. She'd probably have a better handle on it.
Okay. Would you like me to reach out to her?
Yeah,
Okay.
Really?
yes. Dave will reach out
Carrie,
to the nurse for the next meeting.
Carrie.
Her name's Carrie.
It's not Raya anymore.
Huh?
It's not Raya.
Oh, yeah, that's right. Right, took Carrie's
I think they have a
place.
couple now.
I think it's Raya.
Yeah,
Right,
yeah, right.
okay.
So.
Okay, then, in that same vein of illnesses and such, I forwarded to you guys an email that I got today in regards to a Hubbardston person.
Oh, yeah. I got it
And,
right here.
yep, and lead issues, correct?
Yep.
And that had come to MPHN's offices. So
I'm
we
not sure
sent,
why.
that's okay. They received the information. So they emailed me today, and so I forwarded it to you guys. So the basic question here is, Judy, do you want to handle this? Or
Yeah, I
do you
find-
feel that we want to ask them to handle this particular item?
No, I said Diana or I could take it up. It seemed like they were just doing telephone interviews, which is very similar to what we do for Maven.
Correct.
So, I don't see why we can't follow up on that, just to be sure they're following all the doctor instructions and answer any questions.
Okay.
We just need the information.
Okay. And,
So would you take the action to reach out to them to get more information?
so
That's what the
I,
email
MPHN
says,
needs
yeah.
to forward the
okay,
report.
so,
They
as soon
got
as
the
I get
official
home,
report.
as you said, Gael, you have to do it right away in this season, I will email you and
Diana.
Diana, Judy, and the person who sent the email from MPHN.
That was Victoria.
It was, wasn't it?
Yeah.
To send details to you guys. and that we will handle it ourselves. All right.
Yeah, that's something that I had tried when I was with Athol Board of Health, that tried to get programs up and running, but that's a program that, you know, it has fits to get started, and a lot of it because of funding. So they'll get funding and then it'll get pulled away, and if you're going to have a lead screening program, then, you know, it needs to go from year to year, because these little ones need to be tested 3 times before they get into school. And what was going on back then, what we found was that the doctors were screening them like at 1 year, and then they weren't following through at the second and third,
Oh, wow.
age 2 and 3. But they really do need to be tested each and every single year. And so trying to get a program started, because that's a lot of funding, and it's a lot of, and it also requires, you know, staff that's going to be steady and is going to stay there and follow through on the program as well. And we found, Deb and I were out of Deb Carl, I forget what her last name is, but Deborah was the Board of Health agent, and we found working together that it was a difficult program to get up and running, and then follow through. It was going to be also difficult. And I also spoke with the Board of Health of Vicksburg also about that, and they were running into the same issues of being able to get a program up and running, and then being able to follow through on it, you know, as a solid, stable program. So, but yeah, I'll follow through.
Okay. One way that maybe we can at least take one proactive step is to, I'm sure it's out there, little blurbs about signs and symptoms and of lead issues, and the requirement that children should be tested 3 times. And then get that in a little blurb, maybe in the next month, put together, that we can get on our website.
Sure.
Then as a secondary follow-up, we could also send the blurb to the school district, Central Nursing, and ask them if it's okay with them to have the center school send it out.
Yeah.
And that way we could take a positive action just as an awareness action.
Yeah, yeah. Because it's the paint, the old lead paint, and the older homes. It's sweet. It tastes like candy. So they say. I haven't tasted it.
You know, if kids are toddlers and are just,
They're mouthy anyway.
They're
They
very
gotta mouth
mouthy.
everything.
Oh, yeah.
and
Yep.
and you just don't know when there's an issue. Trying to remember recently, it came up on a national TV broadcast about, I think it was a Midwestern city, small city, where they're changing out all the pipes because all the old water pipes in the system, 80% of them, I remember that number because I thought, oh my God, that's terrible, were lead pipes.
Yeah, that was in Michigan.
Yeah, Detroit.
Detroit, yes, Detroit, thank you.
Yeah,
So,
it's unbelievable. It's still going on.
I know, it still exists in some of this area. And that's devastating because it affects everyone, not just the kids. It affects every citizen that lives there.
Yep.
So maybe we can do a little promo, maybe in about a month, and you know, just an FYI, community,
Yeah.
just remember.
Awareness, right?
Yep, became aware that there
Who wants
was.
to create that?
Well, Diana and I will work on that.
Okay.
Okay.
I imagine there's probably something you can just pull.
Yes.
Let
There
voicing
used to
awareness
be,
just, here you go.
we used to
Yeah.
have brochures.
Yes, and I think they're still available through the clearinghouse.
Okay, we used to have brochures. I mean, we could put at the beginning of the promo, you know, that we've decided to do this at this time because we became aware of a person in Hubbardston that had an elevated lead situation that needed following. And, you know, so that they realize, okay, this just isn't pie in the sky thing. This really happened
Right,
already.
yeah, it's local,
in the
right,
last
yep.
month or 2 months, based on whenever we put it out.
Yeah, I mean, we have some old farmhouses here that
Yeah,
are getting
18.
resold at this point.
Mm-hmm.
You know, so,
And yet, you
Yeah.
hope that everything has been replaced, but
Right.
unless you go and have an inspector look at it,
Or actually test.
and
Do
do
the
the water
house test.
tests, you're not sure.
Yeah.
Cool. Thank you. I'm looking through this. I do not see any Title V perk tests for this meeting period. What address is this one? Okay, we have a completed well test from 6 High Street. Apparently they needed to have a new well dug. Our water tables are still way below normal. However, we do not see any follow-up of any kind of water testing. It says that, that's the end of the report. I don't have my reading glasses. Can you see when the well was done?
let's see, the permit was issued September 29th. Date job completed was November 5th.
Okay. All right, so I can just verify that they sent us a completion report. However, Sadie needs to reach out to the property owner slash, they used, who did they use? And the well digger. Oh, Bay State Pump Company. That we need a water test done.
For 6 High Street?
6 High Street, yes. So we've reviewed that. It was completed.
We just need the report.
And we need the water report. It was probably done, but we need a copy of that by the next meeting in 4 weeks, 3.5 weeks.
So for these, when we're reviewing them, we're just looking to see that they're completed?
Mhm.
No flow rates, no pressures, at least no ranges that we're looking for, or anything like
Typically, we haven't.
that? Okay.
Usually the homeowner is going to know right away if there's not enough pressure.
Right.
And go right back to
Not
the
something
driller.
that we're
Required to deal with? No.
Okay.
What we're required to make sure is that they have
Water samples are,
water safety
Right.
once this is done.
okay.
Okay. Next, we have 46 Pitcherville Road.
43.
Oh, excuse me. 43 Pitcherville Road. This is under new construction. Here's the well completion report and a water test report. The water test was done October 7th. The water test shows that their manganese level, although very low, is higher than it should be. E. coli and coliforms were negative. They did tests on all kinds of organic chemicals, and they're all negative. Okay. So on this one, I will pass that around, and so everybody can see it. I think it would be wise for us to contact the builder to remind them that the manganese level is above normal, and a softener system that removes manganese we would strongly suggest they put one in.
I'm surprised, because that's Pitcherville Road. That's over by, we're sitting on top of the watershed, so I'm surprised.
There could be a layer somewhere in the rock that has the manganese in it.
Yeah.
I mean, officially, the,
It's a J for coliform. Looks like it's within its limit.
yeah, on the other test, though, on the other page, it says it was like a 1.
Is that a footnote?
There's no footnote for J.
Saw it at the top of one of the pages. There.
Okay. Yep. Less than 1. Yeah, this is 0.5, so it's good.
Mhm.
Just weird that there's a J.
But they always report everything.
Right.
And you can see all the organic chemicals that they're testing for these days,
Yeah, it's pretty
which is,
fast testing.
So they can pass that around.
Sorry, I could ask another question. So, all right, so we have an elevated manganese.
Manganese, yeah.
We're gonna suggest that they have a softener.
We
put in.
strongly encourage the builder to put one in because whoever's going to buy it is going to see these water tests if they have anybody who looks at anything.
Right.
And it's to the advantage of the builder to put it in before they leave the construction site. It's much easier. Put it in. Because otherwise, they're at risk as a builder to have whoever becomes the new owner go after
Some kind of
them.
lawsuit, yeah.
And it's much easier to put a system in
Right.
than to...
How do we communicate that?
We should have Sadie send a letter
Sadie will, okay.
to the builder. We personally don't need to do that. We can recommend that it gets sent. And
Yeah, that's just a sediment filter. It's not very
right,
costly.
no.
Right? Doesn't need to be a softener or anything, just a
Well, maybe
sediment
an
filter.
advanced, quote, Brita type system.
Right, yeah.
That pulls it out. Yeah. As it comes into the house.
Mhm.
Yeah. Um, Okay.
Not that much over the limit.
No, but
0.09 now.
you know, with droughts, with lots of heavy rains, the levels can change. Passing around, there's no wastewater tests. We have 3 permits. Supposedly. There's only 1 permit here. Oh, excuse me. The Alum Site Work Installer. No permit is in the paperwork. So B is not available. And the Scotty Potty's septic hauler, this permit is for 2026. And I have filled that information in, and everybody else can sign down here.
What is this for? This is just for, like, if there's any event that Scotty Potties can bring their,
They also can, yeah,
or work sites or whatever?
Mhm.
Okay.
yep.
beaver permit.
And this is the beaver permit.
I have a problem with this. What's the date that they want to move the beavers to another pond? This is not the time of year to be disturbing beavers.
Right.
They're all locked up in their little
Huts.
hutch, and they've got, and one of the things they do in preparation for the winter is they create like a pantry of twigs and branches and things like that. And during the winter time, they just come out of their little hut, swim over to their pantry, move back to their little hut and have supper. But you've also got pregnancy too, over the winter time. Babies are born in early spring. So I understand that beavers can create messy stuff.
Okay, so,
But is this really the right, is this really the right timing to be moving them to a pond? Why not give them a fair chance to rebuild? And they wouldn't be able to rebuild right now.
so the concern is, okay, beavers built lodge in my small pond and have been felling trees, small ones so far, but are going to harm large mature variety at surround pond. With mating season beginning could lead to further problems. Problem is not a threat to well or septic, as pond is located at lower level. Problem will be destruction of mature hardwood and evergreen trees surrounding it. Trees and area around them would impact property value and costs of removal and environmental. And based on your point that it's winter time, and they're not going to,
So in essence, the beavers are causing damages currently.
small trees only. He's worried
That eventually is going to become a
that
bigger
if
problem.
they stay, they will start going after the bigger hardwoods, cause the flooding of the roots of the bigger hardwoods.
But with the season for mating, it's like is it around like late winter, like January, February-ish?
A lot of times, the season for mating is early winter, late fall, and then over the winter time, they'll be pregnant
Oh, okay.
and
That's
have
what
the
you want.
babies in the spring.
So where's the letters coming from?
23 days, yeah.
23
It's down by the
Ah, that's what that is.
Grassroots
Okay, yeah.
Country Inn.
down by the country head.
Yeah.
Like the next house.
Yeah, because to me, I feel like it's probably
They're not saying that the dam that they built is causing any flooding issues. They're worried about them
yeah the
cutting
the
trees down.
Right. No, I get that. It's
They probably noticed it because that's exactly what they're doing, is cutting the trees for the winter.
preparing, right?
Right,
Which would mean
put in their pantry.
right.
I
Which-
mean, I just did a whole article on this, on Mass.gov. There's a really nice article about how animals prepare and get settled for the winter.
I make a motion to place a hold on the approval of the beaver permit for 23 Williamsville Road until,
So sorry to interrupt, but I'm just doing a quick research, but
Yep.
it sounds like it's illegal to move them anyway, because they don't make it
You,
territorially.
right.
Well,
They, if you have a beaver permit, I guess they can pick them up and move them to another
And
pond.
emergency permit needed outside the season of trapping.
right.
So right now, they could get a trapper's license, I guess.
I think that's what that is for, in a way. It's like
This is a
This is an emergency permit.
application for a 10-day emergency beaver or muskrat permit.
right.
Yeah, so it's for trapping.
Yeah.
Um,
But But yeah, so but basically, that's what the permit would be for, is
Right,
to allow
is
them
to remove,
to
not
move it.
relocate.
It's not really an emergency. I mean,
Yeah.
The house isn't flooded, the well isn't
Right.
flooded, the
Doesn't sound
septic
like it's an
system isn't
emergency.
flooded.
Yeah, I make a motion that we not approve the beaver permit at this time because it is not a threat to septic or water. But that we will revisit this permit in March?
Yeah, that sounds like.
We'll revisit this permit in March via contact with the homeowner. If it is still an issue then, it'll be close to spring. And if they move the beavers at that time, they will have a better chance of survival.
Yeah, maybe they should come out here next meeting to explain the issues.
Yeah, we can invite them to the next,
We can pull up some information too, additional information.
so my motion is we are not approving the beaver permit tonight at this meeting. We plan to invite the homeowner to come to one of 2 meetings in January where we can review an appropriate plan.
Mhm.
Do I hear a second for that?
Okay.
Okay. All in favor?
Aye.
Aye.
Okay.
Do we have a name of somebody that would be licensed to move them?
We can check with Travis.
Okay. They're actually very beneficial to the environment. But, you know, in the beginning, when they knock down trees and make dams and everything else, it's pretty messy. And it does take about 20 years for you to get yourself a nice field of dirt and grass. Over in Westminster, you know, driving down 2A,
Yeah.
yeah, that's an example. It's been about 20 years now. I've been watching it every time I drive by. So, what kind of trees are growing, what kind of grass is growing.
Right. Yeah, renews the area.
Yeah. There is benefit, but can be messy.
Okay. Clips. Next, any open engineering plans? None. Our old business. Did you get to, two items, there's one on here, tabletop exercise, and second, on the landfill, did you sign this in the office yet?
Nope.
Okay.
Never had a chance to do it.
Okay, I can sign it now. see where to sign it. Ah, here it is. All right, that is now signed. That should be in the minutes. I signed off on the landfill report submitted by Mark Poppin. Okay.
Actually, do you mind if I take a look at it again, the landfill report?
Yep.
So it was the report plus obviously the recommendation for some findings for corrective actions.
The corrective action was to fix the one test site.
Yeah, which I think H 38, 35. Yeah, which is something that we definitely need to discuss further, maybe at our next board meeting, because I reviewed the report. In essence, the goal was to actually discuss should we actually extend, stop, reduce testing.
Right.
But the issue is
So-
we don't have enough data to support that because they haven't been testing that site for a while. That one well.
The one well has missed two tests.
Is that coming from DEP?
It's
No.
coming from a,
It's just the report says it.
Oh,
yeah.
Which we should reach out to Mark Popham and get his opinion on whether they're going to catch that or not.
right.
Yeah.
How significant that is after 30 years of testing.
Correct,
That
correct. That's
one test hole of
10?
10 or
That's right.
16.
That is the question I want to pose to him,
Yeah.
is that
Yeah.
would be insufficient to request a full review and ask for a reduced testing.
Right.
Yeah, we can discuss that and invite him.
Otherwise, they'll just hang up the whole thing again, and we're back to
Well,
Just-
I mean-
He doesn't necessarily have to come to the meeting. If you can just get him to email you a
Verify.
response,
yeah.
Okay.
we can bring that to the meeting and decide from that. So you should have his email.
I do, yeah. Okay.
Okay. The action to be followed up on this is, Gael will email Mark Popham with the question, would this hinder our ability to have decreased testing?
Right.
Because one of many wells has not functioned properly for 2 tests.
Right.
I wouldn't say when the tests occur, but for the last 2 tests.
I think it's the last 2 minutes.
It is.
The Board of Selectmen sent out a survey, and one of the questions on the survey, I don't know if you saw it yet.
I didn't, did it come this afternoon?
Yeah, this morning.
Okay.
So, one of the questions they said is there, I answered the survey as an EMD, but one of the questions that was on is, do you have any projects or other things that you feel that should come before the Board of Selectmen? And from the Board of Health perspective, this may be one,
This is it.
yeah.
This is it because we need to submit for their budget
Right.
testing, an annual test for,
Yeah. And it would be nice
Fiscal
if they
year.
would back us up on saying, enough is enough, time out, you know?
yeah.
So you're saying going to them to present the fees that we're paying for
On
this
the
testing?
survey, they asked if there were some projects or some concerns that we, as a Board of Health, want to put before the Board of Selectmen.
Okay.
So, or something that, and the second, and there was a follow-up, put it on their agenda. Is there some project or concern that you want to put on their agenda? Is this an agenda item? So,
This
my
would be
feeling is
because of
that-
the cost of the test.
Right.
And that it has to be approved annually at the general meeting
Right.
from general accounting funds of the town.
not
That,
to mention the
yes,
fact that it's been 30 years. of
and that
testing.
it's been 30 years.
Yes, so it would be nice to have them put it on their agenda and get their support.
Right.
And currently, because we pay for it,
No, we did not for FY '26, which we're currently halfway through. We
But
got it
if-
approved from the general funds.
oh, yeah, that's right. But previously, we've paid for it before?
Oh, wow.
Yeah,
Yes,
yeah.
for a few years prior to 2020, it was paid from the general fund. So for a period of 5 years, the funding flip-flopped a lot. Prior to 2020, it was always paid as a line item from the general fund, requested by the Board of Health to cover the cost.
At the very
because-
beginning, the Board of Health, at the very beginning, the Board of Health did have
Did
some funds.
funds
and
to
some
cover
funds
it.
finally did, so, but the funds very
For
quickly
very-
ran out.
Right, and from that point until 2020, it was covered. And then the financial things and the change of town administrators kept going back and forth. Sometimes we did pay for it from fees collected out of our revolving account. And sometimes the town would pay for it.
And that also include but we always pay for the maintenance, the grass cutting.
We have.
Yeah, I feel
That's
like
not-
I feel like they should be in one bucket. Testing, monitoring, and maintenance.
My concern is the fact that year after year, it's always cost us $10,000, right from the get-go, right from the beginning. It was $2,500 back in the 90s with 4 times a year, and now, then it went to 2, and then when it dropped down twice a year, we're still looking at $10,000 a year, so 10,
It was 11 in 2024.
So 10
11,000.
10,000 times 30 years, this town has
Yeah,
spent,
that's worth putting on the agenda.
Yeah, and and
Wow.
so it's real important to know Mark Popham's
Yeah,
perspective
yeah, definitely.
on this issue. Because if he thinks we can just address it as it's 30 years, the test results have not shown any issues for 30 years, no matter how many times a year it was tested, we don't even have to go there, and that it's time to stop. Under state law,
Well, there's a
original-
process. There's a
yeah.
process. You
There's a
have-
process
you have
to do it.
apply. Yeah, you have
Yes, I know.
Yeah, yep. There's a process.
I was on the board during 2 times that the people who knew more about it before I became,
Right. And we also need to communicate to the town what we're doing and so forth. because-
yes,
yeah, yeah.
absolutely. So yes,
Yeah.
that is the one main subject that will benefit the town that we can help with. Yeah. Okay. We had talked about a location in town where kratom and nitrous oxide hits were being sold. I apologize. I did nothing. I was going to reach out to the letter writer, and as far as my memory serves me, I did not do that.
I think we'll forgive you.
Yeah, the information I've compiled was mainly regarding the nitrous oxide, but not the kratom itself. I can even email you guys that information, but
I think I emailed about
yeah.
the town of Chelmsford and their decision
Yes.
process.
So
Right.
what was that for? Nitrous oxide or that was for kratom?
Kratom.
Right, I think that's for, yeah.
Yeah.
So in essence, we have like information about both, at least what other towns are doing.
It sounded like they held 2 consecutive discussions with the town to discuss it. and then made their decision to outright ban the sale, manufacture, and distribution, or something like that.
Can you get a copy of them?
There was a
the
copy
ban?
of their ban, yep.
Yeah, you sent that email. Yeah,
Oh,
yeah,
okay.
he sent that email
Yeah.
to
Oh,
us.
I didn't see that, sorry.
There's a million
I will
email going
forgive.
through.
I know, there's a lot. And we could just get in front of it, though.
Yeah, I agree.
Like, it's coming one way or another. The ban, Massachusetts will ban it.
Yeah, there are multiple bills in the house.
There's two bills.
Yeah.
One
There's two
for
bills in the House.
the sale being of individuals over 21, and the other one is to outright ban it.
But they're just sitting somewhere. They're not making any movement, really, so.
Yeah.
Well, it's the end of the year.
Yeah.
Then have to refile at the beginning of the year.
Yeah, I mean, I think it was introduced
to
like
be
since
refiled.
last year, though, was it?
Yeah, it was- It's been sitting for a while.
I mean, they have a ton of things sitting.
I can't believe there's not a lot of Corentum lobbyists.
They probably already have. Who knows? Yeah.
Okay, so we discussed this further, the email, and I'll make a note, second note, with today's date on it.
Well, we probably should reach out to our local legislator and see if he or she, I don't know, at this point. I know,
That will be Berthium
Okay.
and Durant,
okay,
Peter Durant, our senator.
so,
Yeah, I mean, they're pretty active in our area,
so they need to, see what they have to say, see if they have any insight as to,
Yeah, if you want, I can reach out. I'll just say it was Durant.
Yeah, Peter Durant is the senator.
I can reach out to his office and see if there's any
Yeah.
momentum.
Yeah, actually, I think, was it on, yeah, I think at one, next year he's coming to the senior center, I believe. I think I overheard that somewhere. I'll have to double check.
You know, I saw it in the establishment the night that we talked about it, and now I've looked since and I haven't seen it.
Okay.
There's all kinds of interesting things in there, but I think it's under a different name. Because the plant itself has a different name than Corentum.
Right.
The chemical compound.
Right, the chemical
that's-
compound of it, right,
So I
right.
think they have concentrates in there with the chemical compound that makes up Corentum. You used to just say Corentum.
Right, right.
Now it's like,
I mean, that's gonna be a way for you to maneuvering your way around the name,
yeah,
right?
so I think the wording of Chelmsford probably should have addressed the chemical compound rather than
Right.
the actual flower.
Right. So that's the lesson learned for us here.
And it might be, I have to read it again. They
Right.
might have put it in parentheses or something.
Okay. Before finish up with this stuff, do we want to do any discussion on the tabletop after this for a little while or not? Where do we stand?
I started
me.
the report, and I'm up to, I got all the background stuff mostly filled in, our objectives. Capabilities, which I gave you information on. They wanted to know what capabilities, so that was a little tricky, but mass care was one of them. And preparedness, community preparedness was another. So, let's see, let me bring it up.
Would anybody else like some water before I
I'm
sit?
fine, thank you.
Good.
She has printed meeting summary.
Oh, so she has some notes, let me see.
That's the AI that he had.
Was that the
came
one that you
through.
sent her? Yeah, okay. Which was pretty good here.
It was pretty good.
Yeah, that's pretty spot on. I have a very one-page
I don't know who
summary.
Allison is, but,
I had, yeah,
Oh.
yeah.
Because it was, my daughter had reset up the Zoom on my computer. That's who Allison is. That's me.
okay.
It should be Kathy. That's the correction.
Oh, okay.
It's not Allison, it's Kathy.
All right.
And I don't know how to change names on a Zoom contact. Not my cup of tea. But it was me participating.
Yeah, so the capabilities, so I did put in we didn't really specify when we had our table talk, but medical surge was one of them, and that's provide adequate medical evaluation care during events. And then to endure a hazard impact, the healthcare system is able to endure hazard impact, maintain and rapidly recover operations. That's what I emphasized, that were compromised. So a lot of them didn't really apply, but mass care, of course, it makes sense. And so that's what I worked on this afternoon. Community preparedness was the first one. And let's see. What was 3? I could get emergency public information because we talked a lot about reverse 911 and all that. So that's what I kind of worked on today. I'm trying to get it up and running. There was somebody sitting next to Travis. There was Bob here, Travis here.
That was Mima, okay.
The Mimas are on the other side of Melody. Was there somebody between Melody and Travis? Okay. So I got everybody, so they wanted participants, so I got that part set. So right now, I'm up to where I need everybody's notes, so that we get, what are the strengths that we decided that we had, and then the last piece would be, what are the negatives, what are the weaknesses, and then after that will be an action plan. So that's going to be the heart and soul of the report.
Right.
So we're going to need to get together and really take a look at all of that together. So what has happened is Gael has set up a Google Drive for us. So you should now have links, and then that way we can maybe do something virtually.
Okay.
So we don't have to come out in the cold.
Yeah.
Okay.
I hate
It's
coming
a
out in
shared
the cold.
document, so you can edit it in
Okay.
real time.
Right.
Right,
Shared
Simultaneously. Yeah.
right,
Google Doc.
yeah. So we just need to set a date and a night for us to get together and work on the
So this has to
strengths.
be before the 31st?
Has to be filed before the 31st.
Okay.
There goes your Christmas plan.
That's it.
Yeah. So if you had any thought about having a Christmas dinner and all
Christmas
that,
Day?
forget it. Or watching any football games on Sunday.
Well, let's see, Christmas is on Thursday?
Yeah, it is.
Yeah,
Yes.
it's next week, right?
Yeah, next
Yeah,
week.
I know. It's like, I'm not there.
Yeah, have you done any shopping yet? No.
Well,
Amazon's gonna be busy.
I mean, they've been coming in and out of the house, man.
Oh,
It's
yeah.
like,
I'm done.
well, my wife does most of the
Looks
shopping
like we
for our
have-
kids, it's like,
Next week is probably a wash for most.
yeah, next week it's gonna
Right.
be rough.
Well, I'm thinking, Sunday afternoons are usually quiet for me. That might be messes up your football game, but I mean,
I mean, bottom line, right, we can work on, individually work on this document, right?
We could also work individually, right?
right.
Okay,
We're
Right.
supposed to work individually, really.
all right,
about it.
so
But the
between,
document is there on the Google Drive
Mhm.
as far as I've gone.
Okay,
And I can, I'll look at the Google Drive and see if I can also load up. But I gave you the capabilities already in your packets. And you have the template from Worcester. And what else do we need? What else was I looking at today to try to, and the plan, that was pretty much it, was what I
30th
was
is a
looking at
Tuesday.
today,
The 30th, sir?
The 30th is a Tuesday, 2 weeks from now.
So actually, walk me through the mechanism of this process. So who do you send this to, the final report?
HMCC.
Like directly via an email?
Worcester, yeah.
So their offices, are they closed on the 30th?
Yeah, because
On the 30th
I would
they will
assume
be.
they send that thing and that no one's gonna read it until like January 20th.
Well, I hope and pray that HMCC does what they're supposed to do, and that's just forward it on to, put a check mark that Hubbardston submitted it. and-
So then the 29th
Yeah,
is
'cause
the due date.
Really, why would they be sitting and doing any kind of evaluation of the report when it's really a requirement that Department of Public Health is actually requesting. So, but, which means we probably should have it done and ready to go probably around 27, 28, just to be sure.
All right, so I'm gonna try and sit and look at this stuff.
Yeah.
Between now and next Sunday.
Right?
Yes,
Within the next 5 days, yeah.
yeah.
Just bring a nice cup of coffee and just
Look at it and then send in
My
my
hot chocolate,
hot
my
chocolate.
suggestions.
Right?
yeah.
All right,
All right, I'm sending my notes right now.
all right. Gael, may I have those minutes summary from the tabletop meeting?
Yes. That's from the email that Judy sent out. I'm adding
Yeah?
mine in there. Mine kind of include really also Mel took some notes and
Yeah.
she shared them with me.
Yeah. Yeah,
I
that's.
remember we did have an official, Sadie was taking official notes. Did she ever submit that to you guys?
Her notes were very minimal. The AI was much better.
Oh,
And,
don't say that, then that means we're gonna have to replace
But
the
she
AI
was,
guys.
she was only here for
I know.
only part of it.
Here we go, you guys
Um,
gonna replace.
Sir,
Happy.
Morgan Brinker from CERT took a lot of notes.
Oh, she did?
Yes.
Oh, we need to
So we
compel
need
her
to-
to send those notes to us.
Yeah.
Okay.
So Morgan took notes, Melody took notes, AI took notes.
That's a lot of notes.
This isn't a new thing. You were never gonna hear that in a town meeting. Now we can actually employ AI to help us with note
Yeah,
taking. All right.
I like AI. That's pretty good. I mean, yeah, when you read it through, you're gonna have to edit it. Bottom line,
Yeah, but it give you a rough
But
draft.
it leaves you, it at least gets to the essence of what the meeting was.
All right. So basically, I'm just saying that the summary from December 9th with corrections noted from AI reviewed at our meeting.
Yeah.
Just we reviewed it on that. So we
Check
need
your
to,
email, you should have a copy of that in your
Okay.
email.
Yeah, it's in the email. Yep. And I just send you mine too, so we can add that next
Yeah.
meeting.
well, I did get that because I just heard it reflected on my phone.
Like I told you, if I don't do it now, it's never gonna happen. So. Okay.
Okay,
What else
so
Warrants.
we do not have a warrant.
I was
She's
wondering when-
not giving them to us.
when I
We
said this
need
feel like a copy.
paper copies.
Okay.
I'm gonna put a note in here, in the spec.
Was this a subject number 11 email letter?
Yes, that's the
Okay.
one about the Kraton.
Oh, okay.
That was Kraton. No new complaints. I guess there's no other new business right now, is there?
Right. So,
Okay.
so
And
11
then-
is gonna end up becoming a old business, but next time we meet, right?
Which is?
The Creighton National Park
Yes.
side, right? Okay.
It should be on there already.
Okay.
Because we already discussed it once.
Okay. Okay.
Yes, that part was not added in. It's okay. All right. writing this down, even though I've told her. Okay, what we have are 2 turnovers, which are deposits. We do have a permit, well, we have monies collected, which all look fine, except we do not have the paperwork for Allen Sitework Septic Installer. So let's make a note of that. And we do not have the permits for GLM Inc. trash hauler. They paid fees and there's no permit for us to look at.
And there's no warrant for her $55.
That's a whole letter.
Okay.
That's a whole letter, that's not a sticky.
All caps.
Well, underlined in 2 spots, yes. So we cannot approve warrant number 12 because we don't have a paper copy to sign. And cannot approve it until we get one. So on this one. Okay, and that just shows you the monies that came in on that one. And my comments.
What's GLM stand for?
That one I'm not familiar with. I don't know who that
There
is.
was a trash truck, Monadnock, driving down Williamsville the other day from Jaffrey, New Hampshire.
Mm-hmm. I know where it goes.
Yeah.
And we need to get them to pay a
Just
fee
to pay,
also.
right? Yeah.
Mhm.
I was wondering that.
So again, all right. It's, what,
Monadnock?
yeah, right down the trash hauler. And then here's my note on the missing form for this one. Oh, I guess I can text Ally to come get me.
I'd offer you a ride, but my truck is like.
Mm-mm, I can't get in it,
yeah,
sorry.
Pretty tall.
Okay.
be driving next week, hopefully.
It's unbelievably fast.
Which knee did you have done?
Right knee. I gotta practice the movements.
Yeah, I was gonna say.
Yes.
That's all.
That's
very
what
well.
that's holding me back.
Okay.
from doing the right knee.
It would be good to have a third.
Hmm?
Said it would be good to have a third, just pay the permit fee.
Mm-hmm.
Actually, so under item 7B, we did go over that.
We couldn't not.
We couldn't.
We didn't get a permit. There was no printed paper for us
So
to
that's what
sign.
the, okay, all right.
And I wrote a note on there.
Perfect.
It's also for this.
Yep.
All right, yeah,
Right
that's,
there.
that's fine.
We got money, no paperwork.
Okay, got that added. Okay, thank you, folks. I don't see anything else. Anything else we need? The next meeting will be the second Tuesday,
13th.
13, yeah, I think that's what I have here.
January 13, 2026, 7 PM here.
Yep.
And thank you, everyone. I hope you have a Merry Christmas. We'll be emailing each other, so we'll still be in touch about the tabletop action report. And I hope you all have a Merry Christmas.
Merry Christmas.
And
to-
I call the meeting
Right.
adjourned at 8:14 PM.